Twin Transfusion Syndrome, TTTS, affects more than 4,000 babies a year in the U.S. alone. This is double those affected by SIDS, yet TTTS is going unnoticed by many. Approximately 15 to 20% of all identical twin pregnancies with a shared placenta develop twin-to-twin transfusion syndrome. Twin-to-twin transfusion syndrome is a disease of the placenta that affects identical twin, triplet, and other multiple pregnancies which have a shared placenta. The shared monochorionic placenta contains abnormal blood vessels which connect the umbilical cords and circulations of the twins. The common placenta may also be shared unequally by the twins, causing one twin to have too much fluid, while the other twin has too little. The twin with too much fluid is known as the recipient twin. The recipient twin often passes away from heart failure due to the excess of blood being pumped through the heart. This is known as hydrops, which is indicated by fluid building up in the baby's skin and body cavities. The twin with too little fluid is known as the donor twin. This twin is often much smaller in size. The donor twin often has decreasing fluid levels and often becomes shrink-wrapped within the uterus. Both these signs of twin-to-twin transfusion syndrome are visible during an ultrasound and are both fatal if undetected and untreated. It is important to know that neither the recipient nor the donor baby are ever completely safe during a TTTS pregnancy. Since twin-to-twin transfusion syndrome can occur at any time during the pregnancy, even while the mother is in labor at full term, early and frequent ultrasounds are important to provide the earliest detection of TTTS. This provides the best options for treatment and therefore increases chances of survival. Here are 6 things an expectant twin mother should confirm at first ultrasound. Is placenta monochorionic? Are the babies the same sex? Can you see the dividing membrane? Is placenta anterior or posterior? Do the cords have 3 vessels or 2? Are the cords fully attached to the placenta? Here are 9 things to ask at weekly ultrasounds. What is the largest vertical pocket of fluid for each baby? Can you see the bladder of the donor baby? What are the weights of the babies in grams? Ask this every 2 to 3 weeks. Are the Dopplers normal for both babies? Is the heart of the recipient baby enlarged or thickened? Does the recipient baby have hydrops? What is the measurement of your cervix? Is it long and closed, or thinning or dilated? Is the smaller baby growing at the same rate? What is the fundal height? There are 2 ways to treat twin-to-twin transfusion syndrome. One way is treating the connecting blood vessels causing the TTTS, and the other is to treat the symptoms of TTTS. Though both increase survival rate, neither is a cure. Treating the connecting blood vessels involves fetoscopic placental laser therapy. This is the insertion of a tiny telescope into the pregnant uterus, allowing the doctor to go in to the connecting vessels and destroy the connection between the 2 umbilical cords. Though the surgery increases survival rate, it is not always an option and varies by individual case. There are 2 options for treating the symptoms of twin-to-twin transfusion syndrome. The first involves therapeutic reduction amniocentesis, which is the most common treatment due to its wide availability. This procedure drains excess fluid from around the recipient twin by inserting a needle into the amniotic sac of the baby. This reduces the pressure inside the womb. The second option for treating the symptoms of TTTS is an amniotic septostomy. Once thought to help, it's no longer supported by the medical community at large. This procedure allows the doctor to intentionally create a hole in the membrane between the baby's sacs of water with the needle. This hole allows some of the excess fluid in the recipient's bag to enter the sac of the donor. The risks to a septostomy is that the hole that is created from the procedure can tear, which causes the twins to become monoamniotic twins, which then creates a 50% chance of cord entanglement, resulting in the death of one or both babies. Another risk with this procedure is that it takes away the ability to track TTTS. Doctors need to see the fluid equalize because the syndrome has ended, not because a hole was created. This gives a false sense that the syndrome has been corrected when in reality it has not. The Twin Transfusion Syndrome Foundation has found that the most efficient way to recover the nutritional losses that occur during a TTTS pregnancy, as well as to support the twins, is proper nutrition and bed rest. Liquid dietary supplements, such as Boost, Carnation Instant Breakfast, Ensure Plus, and others that are soy-based, are recommended. They are to be sipped slowly and continually throughout the day, in addition to normal meals. Bed rest, also known as horizontal rest, is also very important in a TTTS pregnancy. A leave of absence from work is highly recommended, as it is best that a mom remain laying on her side. A mom laying on her side continually during the pregnancy will help blood flow and oxygen to the womb, which helps in removing some of the excess fluid in the mother's body and takes pressure off the cervix.